which is dry eye disease, almost synonymous with dry eye. Dry eye is a problem that involves not only the aqueous or the watery substance of the tears, which comes from the lacrimal gland, which is up here, guys. It's located right up here underneath. But it also has to do with all the various types of glands that are in the eyelids. So we have 45 glands here, roughly, on each side, which are called meibomian glands. And they're responsible, as well as other glands of the lids that are not in that same 45 segments, but we have glands of Krauss and Mole in Wolfram, in meibomian. Okay, so all those contribute to lipids, proteins, oils, sebaceous material, mucin, and all these ingredients coming from the lid glands, they combine with the aqueous, the watery part of the lacrimal gland. That then allows the tear layer to be evenly coated across the eye and not splotch up or dry up or evaporate. So when patients have ocular surface disease, almost always they need their lids treated. Firstly, we need to take a meibography. We need to take scans of the lids. And that's going to direct us as to what we think their prognosis is going to be. Prognosis is how quickly they respond to treatment, how well, how long, how many treatments. So we can take a look at the meibography, and that's going to tell us how badly are those lid glands damaged, how many are dead, how many have partial vitality, how many are actually functioning well. And using the keratograph will not only tell us about meibography, but it's going to tell us about the tear breakup time, also known as BUT. And it's also going to tell us about the lipid layer. And we'll be able to see the topography, so that shows us how the tears are breaking up. So that, but even without meibography, we know that we need to do all these other tests, which will be, the next thing what needs to be done is BlephX. BlephX needs to be done, and that's to clean, to exfoliate the lids, both upper and lower lids, of all the scurf, which is the flakes and debris from blepharitis caused by bacteria, and cleaning up the Demodex, the collarettes that are wrapped around the hair follicle, the lid follicle. So it cleans up all that, and now after cleaning up all that, it's now up to the patient to maintain that cleanliness by using Blefadex lid wipes each evening, every evening, by taking the lid wipes, first starting on the lower lid of one eye, let's say the right, and then going to the lower lid of the left eye. And that's getting right there at the base of the lashes, both above and below the lashes. And then after doing the lowers, you go to the uppers, again, below the lash margin and above, and rubbing along that lash line to really keep things clean. The patient also is now going to need eye lux, so whereby that we heat the lids, both the inside of the lid and the outside, and then we bring the two paddles together and express the glands free of all the constipated tear or the gland materials that are supposed to be coming out readily get constipated. So that was going to open things up. But then it's up to the patient to maintain that opening, that freedom of the glandular material coming out by using heat. We'll have some patients use the heat each night. If they have a really bad case, we'll have the patient use heat less often if they're able to get by with it. It's going to be based upon how many symptoms they have. And still the patient's going to need to use artificial tears, and they'll have to use them very often, sometimes even every hour. If you use them that often, if you use artificial tears that have a preservative in it, the preservative itself used that often is toxic. That's why we always recommend non-preserved artificial tears. In really bad cases, we may be prescribing a steroid drop. We may also be prescribing a medication called Restasis or Xiidra. Each are designed to cause the eyes to produce more aqueous. This is coming again from the lacrimal gland. And this is much more commonly used in cases of autoimmune disease such as Raynaud's or sarcoidosis or lupus, or if you have some bowel problems with all the different autoimmune diseases, okay? So now let's pause that for just a moment and think, are there some areas I'm missing?